Welcome to Paul's Heart. I'm Paul, and this is part two of my talk about late term side effects from cancer treatments, part two of my conversation about my heart. So, my bypass was not the only time that I had to deal with my heart, but the surgeons back in 2008 felt that they got everything that they needed to. And I mentioned that they let an artery go, not repairing it. And I also mentioned about radiation being the gift that keeps on giving. So we fast forward to the year 2019, 11 years later, and that artery that hadn't been bypassed needed attention. And I ended up having to have that stented. I want to go back a little bit. Make sure you go back and watch part one, okay, of this video series. It'll make it a lot easier to follow. And also, I want to make sure I offer the disclaimer. I'm not a doctor. I'm not giving anybody medical advice. I'm giving strictly my experiences with these late side effects. So I had that stent, and when that stent had to be done, I had no symptoms. I simply went for a follow-up. Went to do a stress test, and after I got done, the doctor was like, you need to see somebody. And 2 weeks later, I had a stent done, which was a lot better than having my chest opened again. Then in 2021, another component of my heart, my aortic valve, needed desperate attention. This little bugger right here is a replica, an actual size replica of my aortic valve replacement. It's a replica of a tissue valve, not the mechanical kind. But this went up through my leg, through an artery, and placed inside my heart. Can't really go into the weeds with this on this video, but you follow me along, you'll hear that story. That's not it as far as my heart is concerned. I do have other issues with it. I've got what's known as a left bundle branch block, and recently I was diagnosed with myocardial ischemia, which basically means the lower part of my heart is not getting enough blood to it. I also have what's called an inverted T wave and reversed septal wall motion. So my heart's a mess, courtesy of my treatments. Again, this doesn't happen to everyone. But the problem is, how do you know if it's going to be you or not? That's why I stress you need to be followed up by your primary care doctor after you're released by your oncologist, because they're the only ones who are going to be able to keep an eye out for this. Now, I've been clear. I don't live my life looking at like I'm done. I'm not going to be around much longer. I'm going through life expecting to do whatever I need to do. I've been enjoying watching my daughters grow into adults, and I'm looking forward to many more years with that. But you have to pay attention to things like symptoms, in particular, like when it came time to repair this bad boy, I had shortness of breath, really bad. In other words, I could barely get up out of this chair and go to my kitchen. I do have mild levels of that right now. That's because of all the other issues with my heart. There's fluid. I have swelling in my legs daily. I have to spend a lot of times with my feet elevated. And then, of course, there's weight swings. I have 5 to 6 pound weight swings every day. It goes up, it goes down. That's not normal, okay? But that's what happens when your heart has to work harder than what it's supposed to. Now, I do take lots of medications. I think my count is up to 13. And of those 13, I take 2 that are blood thinners. I take 3 that are for blood pressure and heart rate control. And I take 2 for water pills, basically, to help drop the water weight off me every night. I start off losing the water weight, and then the next day I gain that water weight back. It happens every day. That's because of my heart. So along with medications, weight loss, I'll be the first one to tell you I need to drop some weight. I've been doing it. It does help to a degree. Diet, I'm a picky eater. I've had many suggestions about going plant-based. I don't know necessarily if any of that stuff is going to help me or not. But one thing I do know is that low salt diet does make a difference. That I seem to retain a lot more fluids when I eat foods with salt. And if you go out to eat, guaranteed you're getting way too much salt because the chefs always put extra salt in it. Exercise, listen, you don't have to go to Planet Fitness or anything else like that. The simple act of going for walks, a simple walk, not even necessarily a fast paced walk. Just go for walks. Take a 5-minute walk, 10-minute walk, or whatever. Just get some simple exercise. And of course, always follow the doctor's advice that they give you. I want to make sure that I've covered everything in here. There's no doubt, and I know that there's going to come a time that all the repairs that I've had done already are probably going to face needing to be redone. They're temporary fixes. But again, I want to stress, not everyone is going to develop these late side effects. Today's treatments with radiation, especially if they're avoiding exposing your heart to radiation, you got a pretty good chance of not having to deal with it. But if you're like me, somebody treated 20, 30, 40, 50 years ago, you've got a pretty good chance that you need to have your heart looked at. And there's no way for you to know if you're going to be the one or not. So it starts with surveillance from your primary care doctor. You get seen as often as you need to. If your heart is healthy, see you in a number of years. If you've got something going on, you have a baseline with your primary care doctor. Okay? And then you go from there with how often you have to go back. But I have to tell you, from the words of my cardiologist, it wasn't a question of if I was going to be unalived. I have to use that word for TikTok purposes, but you get what that means. It wasn't a question of if it was going to happen. It was a question of when. Because I had those symptoms, I didn't pay attention to them, and I definitely wasn't aware of what was going on with my body between the radiation, between possibly any problems from the adriamycin and bleomycin. But you've got to pay attention to that stuff and act on it. I can't stress that enough. I will tell you that I've lost many fellow survivors who weren't aware that they had these issues. And I've seen many survivors get through getting these repairs done once they've been discovered. No, it's not easy, and it can be scary, but they can be dealt with also. So with that in mind, that's going to be the end of my series on late side effects from treatments, in particular the heart. I will be covering my other late side effects in more detail so you can see where I'm getting at depending on what you're dealing with, whether it's breast cancer, whether it's thyroid cancer. And yes, men can get breast cancer, especially if they were treated with radiation. But everything, bones, fertility issues, hair, and things like that. I'm going to get into those in other videos as well. As always, I appreciate you tuning in. Please watch part 1 and part 2. And if you know anybody else that's looking for this kind of information, please make sure that you share my page. You can also find me on YouTube at Paul's Heart. You can find my website, www.paulsheart.com. And of course, I do mention my heart issues in my book, Paul's Heart, Life as a Dad and a 35-year cancer survivor, on Amazon. And you can see these 2 little girls on there. They're now adults. Okay, this is why I record these videos. This is why I continue to survive. They're my driving force behind this. They also had a help in designing this book. Until next time, this is Paul's Heart.